I'm curious, Dr. Ann, in your particular field, can you tell me a little bit about the challenges that you face?
Yes, as a neonatologist, when I work in the United States, actually, we have amazing medical interventions for our newborns, and we can save the lives of most of the babies who are admitted to our Neonatal Intensive Care Unit. But when I work in Rwanda, where I've been for almost 10 years, I'm so struck by the fact that many babies die of essentially completely preventable problems, usually moderate prematurity or a relatively mild breathing problem or infection. But one condition that's common to the preventable deaths of many babies in poor countries is a condition called neonatal hypothermia.
Okay, when I think of poor countries, I mean, I have to say, I usually think of hot temperatures, so this is perplexing to me. Can you tell me a little bit about hypothermia in places like Africa?
Actually, your reaction is very common. People think sub-Saharan Africa, it sounds like it would be very hot there. We're all boiling hot, how could a baby possibly be cold? But something that is not very well known by the general public is that when babies are born preterm or low birth weight or ill, they tend to cool towards the temperature of their environment, kind of like a reptile. So even if it's 80 degrees outside and we would be very hot, if a baby cools towards 80 degrees, then that baby will die.
Wow, that's absolutely extraordinary. So yesterday at the Humanity 2.0 Forum, you showed us something, the infant warmer. Can you tell me a little bit about this intervention and how you hope it will help?
Sure. The infant warmer came out of my frustrations with the options available to keep babies warm in resource-limited settings. Currently, there are two most common options. One is to try to use the electrical medical equipment that we have in rich countries and use it in a poor country. An incubator is the most common electrical medical equipment that people use. And incubators are extremely effective, but in poor countries, they have several major limitations. One is that they're extremely expensive. They generally cost tens of thousands of dollars. Obviously, they require a constant electricity source. They're very hard to teach people how to use well, and they can cause hypo and hyperthermia, both of which are quite bad for your health. They are quite difficult to clean, and so they raise a lot of infection control issues. And finally, they're very difficult to maintain, and often when they break, they just need to be thrown away. The other option that is wonderful that people use around the world is something that's called skin-to-skin care. You might also hear it referred to as kangaroo mother care, where a baby is placed naked on the mother's chest, and the mother provides the external heat source for the baby. This is a wonderful approach, and it has lots of benefits beyond just providing external heat. It promotes maternal-child bonding, and it is great for breastfeeding. But it also has some limitations that are very important. For the smallest of babies, it often just does not provide enough heat. And so babies are doing the skin-to-skin care, but if you take their temperature, they're still cold. So those babies need to have either an alternative or an additive source of heat. The other problem, though, is that if mothers tragically die during childbirth or if they're very ill postpartum, they can't do skin-to-skin. If the baby is sick postpartum, then the position on the mother's chest makes it very difficult to do medical assessments or treatments. And if the mother has twins or triplets, it becomes increasingly unfeasible for her to keep all of her babies warm. But even if it was working extremely well, mothers need to get up in the day and attend to other tasks, such as bathing or cooking over a hot fire or taking care of their other children. So it's not very realistic to expect them to be human incubators 24 hours a day, 7 days a week for the weeks to even months that it takes for babies to grow big enough and fat enough to no longer need an external heat source. So what we did was made a very simple, intuitive, easy to use, non-electric infant warmer. And our goal is to have it cost about $20, so obviously much, much less expensive than the incubators. And it's made of a wax that melts just at skin temperature. And it stays that way for about 6 hours. It's very, very simple to use, and we found that nurses can be trained to prepare it and use it and clean it in just a couple of minutes. In the areas where hypothermia is a major problem, generally babies don't have diapers and there's no clothes washers. So it's specifically designed to have no fabric or Velcro attached that would make it difficult to wash. And it can be used in the hospital setting, clinic setting, transport, or home. And we've also now found it would have potential use in malnutrition wards and also in refugee camps. So it can either be used with a baby placed naked on the warmer and covered with a hat and a blanket, or if the mother wants to provide the skin-to-skin care and then have the mattress as an additional source of heat, it can be used in that way. So it's intended to support or complement skin-to-skin care.
So Dr. Ann, if I'm getting this right, basically you're telling me that babies around the world are dying of hypothermia, and you have a $20 solution to this problem.
That's correct.
Okay. Have you found distributing that solution to be an easy thing? Are people coming to you eagerly asking for your infant warmers, or has it been a challenge?
It's been challenging for several reasons. One is, as you just said, you're not aware of it as being a problem. And so I think that the world is not focused on the condition of neonatal hypothermia. And also, the way to have something like this be available around the world just takes a lot of things to line up, to be able to figure out how to test it and make sure that it works well, to manufacture it, to distribute it, and to make sure that people are aware both of the problem and that the solution exists. So it's a slow road, and I feel terribly that it does take so long, because we know that babies are dying from hypothermia at a very fast clip. It's estimated that, I may have mentioned earlier, that there are about 1 million babies in which hypothermia contributes to their death. And so that's about a baby every 2 minutes.
A year? So you're saying 1 million babies die a year from hypothermia?
In which hypothermia is a contributing cause. So it's a huge burden of suffering. And actually, for every baby who dies, there's many, many more who suffer the morbidities of hypothermia.
Dr. Ann, one of the things that you said earlier, coming back to this issue of stress and how it affects the brain, you mentioned to me that actually heat actually has a role in the development of the brain. Can you tell me a little bit more about that from the context of, again, the developing world?
Sure. So when babies are born preterm, we're really taking care of them for some portion of the last trimester. And so we are trying to create a condition that's as close to still being in the uterus as possible. And when babies are in a uterus, they don't need to maintain their own temperature. That's provided by their mother. When babies are born and they're preterm, as I mentioned earlier, they need an external heat source to keep their temperature in a normal range. As their temperature starts to drop, then they kick in their own metabolism to try to get their temperature back up into a normal range. They can't do it very effectively because they can't really shiver, and there's some complex physiology about that, but it's very difficult for them to do. But they're going to be expending calories trying to get their temperature back up into a normal range. One thing that we understand very well is for preterm, low birth weight babies to have the best outcome that they can, they need to be provided with optimal nutrition and growth. And when the calories that we give are all being taken up trying to have that baby maintain its temperature in a normal range, we know that it impairs their growth, and that includes their brain growth, and therefore impairs their neurodevelopment. So it is another form of stress for a baby to have the burden of trying to keep that baby girl or boy in a normal temperature range.